How to prevent high blood pressure. Did you know that a high blood pressure can damage your heart and cause health problems if it stays high for a long time? Cardiovascular disease is the leading cause of death in the world, and a high blood pressure is one of the most important risk factors for this disease. Did you know that when your blood pressure is not controlled, it can lead you to getting a heart attack or heart failure, vision loss, stroke, kidney disease, and trouble with memory or understanding? Did you know that a raised blood pressure is responsible for 7.6 million deaths per year worldwide? Around 54% of cases of stroke and 47% cases of coronary artery disease are attributable to high blood pressure. High blood pressure is causing more deaths in the United States. In 2019, more than 500,000 deaths were recorded having a high blood pressure as a primary or contributing cause of death. Hypertension remains a silent killer. You might be wondering, how does high blood pressure cause death? Welcome to Healthier Life, a channel where we talk about your health to help you live healthier life. If you like content like this, it would help this channel a whole lot if you like this video and subscribe to this channel. Now let's continue. High blood pressure forces the heart to work harder to pump blood to the rest of your body. This causes the lower left heart chamber, which is the left ventricle, to thicken. A thickened left ventricle increases the risk of heart attack, heart failure, and sudden cardiac death. A survey that was conducted between 2017 and 2018 showed that the prevalence of age-adjusted hypertension was 45.4% among adults and was higher among men than women. Another survey showed that for ages 18 to 39, hypertension increased by 22.4%, and for ages 40 to 59, it increased by 54.5%, while for those who are 60 years and older, hypertension increased by 74.5%. This is very alarming. For more details on these surveys, see the link in the description below. Among men, the age-adjusted prevalence of hypertension was higher among non-Hispanic Black, which was 57.2%, than in non-Hispanic White, which was 50.2%, and in Hispanic adults, it was 50.1%. Percentages of hypertension are similar between non-Hispanic White and Hispanic men. Now, let's dig into what high blood pressure is, or what hypertension is. What is high blood pressure? The Center for Disease Control and Prevention defines a systolic blood pressure, which is the top number, to be greater than 130, and for the diastolic blood pressure, which is the bottom number, to be greater than 80, as being hypertensive. For more details on this, see the link in the description below. What can cause a high blood pressure? Number 1, diabetes. Research is showing that 6 out of 10 people who have diabetes have a high blood pressure. Talk to your doctor to help you understand how to control your diabetes. 2, a poor diet. When you eat foods that are high in salt or sodium, this puts you at risk for high blood pressure. When your body holds on to water, it increases your blood pressure in your system. 3, lack of physical activity or exercise. When your body is active, this strengthens your heart and blood vessels, which improves your health by lowering your blood pressure to a normal level. 4, obesity. Being overweight or obese means that your heart is working harder to pump blood all over your body. This ends up raising your blood pressure. 5, tobacco use or smoking. Nicotine in tobacco increases the risk of high blood pressure. Smoking can damage the heart and blood vessels. Breathing in carbon monoxide reduces the amount of oxygen that your blood can carry. 6, family history. Having a family history of close relatives with high blood pressure puts you at risk for high blood pressure as well. This information about your relatives helps you to pay close attention to your blood pressure in order to have it under control. Sometimes you might be wondering, What makes my blood pressure high on some days, especially when I go to the doctor's office? Here's what happens. Number 1, nervousness. Have you ever heard of the white coat syndrome? Many people have a high blood pressure every time they go to their doctor's office. Isn't that weird? This does not necessarily mean that you have a high blood pressure. It is the nerves that are affecting your blood pressure. But it is important for you to keep checking it so it is not consistent. 2. Talking, eating, or drinking during blood pressure readings can raise your blood pressure. Crossing your legs and letting your arm drop at your side rather than rest on a table at the chest height can make your blood pressure go up. So, the next time you're taking your blood pressure reading, be mindful of those points. How can you prevent high blood pressure? Eat a healthy diet. Have a healthy weight. Stay active. Do not smoke and get enough sleep. For more information about how you can stay healthy alive, see the links in the description below for the rest of my videos on this channel. Do not forget to like this video and subscribe. Now, let's look at how you can manage your blood pressure at home. Buy a blood pressure monitor. An average blood pressure monitor ranges from $20 to $50. Or, better still, call your health insurance company and see if they can cover it for you. You might be surprised how willing they will be, considering when you become hypertensive, they will be incurring those costs as well. So, go ahead and call them. If your blood pressure is greater than the recommended guidelines, record those numbers and call your doctor with your numbers logged. Take control of your health by living healthy alive. Do not forget to like this video and subscribe to this channel for more tips like